Hey guys, so today is a completely different topic. This is not entertainment. We are in the medical area. So I'm here in Leipzig, Germany. This is called Medic Space, and this is the first European medical summit with spatial computing. And everything here is focused on Apple Vision Pro because it has a high resolution and so on, you know that already. And behind me we can also already see some booth where they show different things, like in the operation room or so, where they use the Apple Vision Pro for different things, and this is gonna be completely different than the content I normally show you. Very interesting. And yeah, my wife is also here. She's a doctor and she has a lot of more knowledge than me. I'm the technical guy, you know that. And there's also a lot of conferences with speakers and so on, and I will show it to you in this video. My name is Thomas and you're watching VoodooDE VR. Let's have some fun with the video and let's go.
VoodooDE.
Okay guys, so we will report about all the things we've seen, like all the booths, and they were also speakers on the stage. So we will go through all the different things that we've experienced. My wife is also here. She's a doctor. She has a lot, 1000% more knowledge about this than me, of course. And yeah, she will also talk a little bit about this. So let's start. Right at the first booth, they showcased a smart system that uses computer vision to recognize surgical instruments like bipolar forceps. I was able to easily control the surgical camera using voice commands or a pinch gesture, allowing it to automatically follow the instrument. In the future, they even plan to overlay 3D models of brain structures directly onto the patient, which should make the daily surgical routine much easier, of course.
Yes, on the next I took a look at the navigation system for neurosurgery that overlays dry deep patient scans to calculate the perfect entry angle for a ventricular drainage. When testing it on a haptic phantom model, the accuracy was impressive, 3 millimeter. That's barely worse than in insanely expensive competing systems, and it's perfectly suited for both training and later use in the operating room.
Mm-hmm. Next up was microsurgery, where huge microscopes are being replaced by compact exoscopes. I could examine high-resolution 3D structures of tissues and blood vessels without having to strain my neck staring through eyepiece for hours. Using special anatomical tweezers, I was able to wonderfully simulate surgery on a model which drastically improves ergonomics for surgeons.
Yeah, that was wonderful. A completely different but super exciting field was the 3D printing for rescue operation. Here they print thermoplastic splints with integrated heating wires for the emergency doctor can hit directly in the ambulance. This allows the material to be perfectly adapted on one side to the patient's fracture or injured joints.
I also found the smart materials really mind-blowing. Materials that essentially remember their shape. For example, there are compression stockings that automatically shrink when heated with a hairdryer. Another example were special bone screws for hip implants that expand like an anchor when exposed to heat, significantly delaying the need for revision surgery.
That's very important for a patient that he hasn't to go to another operation that are there are not risks, there are no more operation, no more blood. No more blood verlust.
Bloodloss.
Bloodloss, no?
Yeah.
Genau. Yeah. And before diving deeper in the medical apps, we also had a session with Apple where they showed us some really cool apps for the Vision Pro. No?
Yeah, that was a special session only for us.
Only for us, exclusively for us.
It was in the fifth floor of this hotel. Everything was took place in this hotel, and then they took us there, and then they showed us like cool different apps. And for her, for her, they already made like beginners features for the Apple Vision Pro. They showed her how to manage that, how to get into the menu and so on. They could even explain it better than me because they are from Apple. They only use the Vision Pro. So for her was really exciting. The complete HeartX app was particularly impressive, projecting an incredibly detailed beating 3D heart right into the room. You can overlay arteries, look directly through the heart valves, and even visually analyze the blood and electrical flow. There was also a simulation where I could practice palpating a vein and drawing blood on a virtual patient with blocked arteries.
That was impressive. No, you are not a nurse, no, but you could do it.
Yeah, I could do it now. Yeah, no problem.
so we go back to radiology. No, I checked out on the Visage
Visage app. Yeah.
So for the radiology, I checked out the Visage app, no, which makes CTs and MRI scans spatially tangible. No? Using a sample patient, no, I was able to virtually out through different tissue layers using hand gestures. No? Hiding or showing skin or bones, it's not just brilliant for the surgical planning, but it also helps explains finding to patient in a way that they can easily understand. No?
Yeah, really impressive. Yeah. And a completely different use case was a real estate app. So this, of course, has nothing in common with the medical things, but that lets you virtually tour buildings or apartments. So first you see the floor plan as a small dollhouse on the table in front of you. And after that you can teleport directly into the rooms at true scale and take a look around at your own pace. And that's really cool for like when you want to visit like 15 different real estates, and you can do that from your home and visit the apartments or buildings or so. Absolutely amazing.
That was amazing. But what comes is more amazing. No? To demonstrate the headset's performance, there was a small entertainment segment with extremely high resolution immersive videos for the Apple TV. No? Since the image is transmitted with a tiny latency of just 11 to 12 milliseconds, no? Motion sickness is truly a thing for the past here. No? Even with fast movements or the visual experience remains extremely smooth and comfortable for the eyes. No? I could experience that myself. No? You know my troubles, no? With the
with other headsets.
With the other headset, that my head spins, no? the whole time.
Yeah, she didn't have any problems like headache or eye strain or motion sickness. Really
I could enjoy it.
Yeah, because of the small latency. So guys, at the final booth before the presentations, later we will talk about the presentations, there was a chest practice station for treating a tension pneumothorax or collapsed lung. The system precisely measures the entry angle and needle depth in the intercostal space. You get instant feedback on whether you hit the right spot, which is absolutely invaluable for medical training.
Of course, no. For we say we as doctors we try every day to not to do procedures that have complication. No? When you know where you are, that's a perfect model. Better you cannot have it. I think. So later on the stage, the presentation kicked off with extremely exciting telemedicine concept, no? Where surgical consultation across a distance from 10,000 kilometers worked flawlessly. No? The technology is even being heavily utilized in veterinary medicine already. No? We saw it already in the presentation. No? For instance, they showed how a tumor accounting for 20% of a dog's body weight was safely removed using 3D navigation.
Yeah, that was so amazing when we saw the dog and the surgeon saw the dog and he was remotely connected to another doctor that was in San Diego, and I think the surgeon was in Germany, and that was like, this is crazy, and they did that in real time. Yeah, and then they removed the tumor with the help of somebody who was so far away, and the dog survived. This is freaking insane.
The sweet dog went home the same day,
after
a few hours.
Same day,
the same day after a few hours. Amazing.
Yeah. Amazing. Yeah. And in eye surgery, operations are literally formed at the micrometer level, which is why the camera signal must be streamed absolutely latency free in 4K. That's a big topic. They always talked about latency, very important. A doctor demonstrated how the headset finally allows him to sit in an ergonomic posture while external cameras project the image directly in front of his eyes. A wrong cut on the wafer-thin cellophane membrane would be fatal, which is why this precision determines life and eyesight here.
Yeah, that's very, very important. No? We were talking about eyesight, no? But we do a brief excursion. A brief excursion in the industry was also included, no? As Porsche is already using spatial computer very practically. No? They use the headset for the employees training, no? On efficient route guidance into their huge factory. No? Furthermore, the system helps to quickly and flawlessly identify specific vehicle components during production.
Yeah, that was a really excursion because that has nothing in common with medicine, but there was the CEO of Porsche Leipzig, and he showed us how they use the Vision Pro with their production line of the Porsche vehicles. Very, very interesting.
That was interesting. On the Porsche is our pride. Yeah, you know that.
Yeah,
we need to do as better as it can.
Yeah, if you come to Germany, drive a Porsche and then go as fast as you want. You know, we have some areas at the German Autobahn where you can go as fast as you want. Try that out. Yeah, try that out. And then Apple themselves emphasized on stage how important health features are to them, from the integrated hearing aid to measuring walking steadiness. They see the Vision Pro as an absolute flagship project for medical education and visualization. Whether it's a young medical student or a seasoned chief physician, everyone can learn something new through the spatial representation of anatomy.
I wish I had the Apple Vision Pro as I was a student. No?
Yeah.
That could be a huge help. No?
Yeah,
but I have still the opportunity to see it all.
It's completely different to see that in. You can just put that in like a real heart of a human, just right into your room and then walk around it and so on, and then you can touch it and show everything. This is brilliant.
That can spare hours of studying.
Yeah, absolutely.
As a student, I used to spend hours studying a model that was 2D. So an absolute goosebump moment was the report of the separation of conjoined twins attached at the head. To reconstruct the missing skull caps, doctors used a combination of AI and XR technology. With seconds, fitting implants were generating from 108 babies and so had a database and 3D prints and so, allowing these two children to live a perfectly normal life.
Yeah, that was impressive that they could separate these two babies with this technology. Wow, absolutely amazing. Yeah.
That's gonna change the future.
Yeah. The next presentation showed precise biopsy navigation where the needle is exactly tracked in space and using special image trackers. These are like small infrared trackers that you can put on whatever, a flashlight or whatever you want, and then it's tracked by the Apple Vision Pro. Fittingly, the new visionOS 27 update for vastly improved object tracking were also introduced. I will show a video to you later when it's out. Perhaps I will do some shorts about the visionOS 27 update. There are really cool features included. So surgeons can now spatially track surgical accessories, like, as I said, the smart flashlights, and seamlessly use physical buttons on the devices. Really, really nice.
It's really nice indeed. No? So, what's important out in the medical field? Documentation. No? For case discussion known as tumor boards, no? The spatial representation of the CT scans offers huge advantage for decision making. No? Complex bone fracture or carotid stenosis can be grasped and discussed much faster by the medical panel. No? The surgeon can also precisely plan in advance how to maintain a safe margin around the tumor during the procedure. No?
Yeah.
It's amazing.
Absolutely amazing. And another update to the complete HeartX that we already talked about focused heavily on neurology and brain function. Using a fictional stroke patient as an example, it illustrated how a blockage in the middle cerebral artery affects the motor cortex. By linking real MRI data with anatomical 3D models, such as clinical pictures, they become instantly visual, tangible.
That's very important for patients with stroke, that we can access directly very fast to the case. I see it so. So to end the annoying cable clutter in the operation room, a new hardware box were presented with wirelessly streams endoscope, ultrasounds and PEX imaging into the headset. The surgeon simply looks at the system, and all available monitors appear directly in the virtual field of the view. With the collaboration mode, colleagues can even draw important remote annotations directly in the surgical field of vision.
Yeah, that's a big topic. Nearly everybody talked about placing like different monitors in the air somewhere in your room with the Apple Vision Pro, and so to learn and also to collaborate, as we talked about, like this guy was 10,000 kilometers away, and they really focus on that. Like, it's not like only that you do the surgery, it's also about information that's placed around you. That's a big topic.
Yeah, it's a big topic indeed. So in the operation room, you don't need to lose your concentration. You need to have all the information for your eyes.
Yeah.
I think it's amazing. In the plastic surgery, doctors use CT slices to trace fine artery strides through the abdominal muscle. It allows the complex design of the tissue transplants to be planned perfectly and stress-free in advance. The risk of injury important nerves or blood vessel while cutting is nearby massively minimized.
Another nice example. But also another app was very impressive. Using a real patient example, they showed a tiny tracker on the teeth synchronizes the skull CT with reality. Wow! This allows the doctor to insert a titanium mesh at the eye socket with millimeter precision without touching the sensitive optic nerve. So it absolutely helps the surgeon.
The work helps the surgeon. They make it less complicated for the patient. That's important. So the Sinai Hospital provided proof that with Vision Pro can also be extreme physiological help with the robotic Saya. This virtual therapist was trained by real psychologists to demonstrate active listening and strong empathy. In a peaceful VR environment, she supports patients in processing severe personal tragedies or trauma.
Yeah, but it's very important to know that there is still a human psychologist. It's not only that they are treated from the AI. This is only a small part of the whole procedure. That's very important.
So in the corneal surgery, it was demonstrating how eye implants are inserted with extreme precision on unsteady hand. The surgeon can arrange in their cockpits of various monitors exactly as needed for the procedure. All the time, medical students in the room can follow the surgeon's exact field of life on large screens. That educational, I find it amazing.
That's also about learning.
About learning what the student can benefit.
Yeah, absolutely amazing. In the treatment of pediatric kidney tumors, it was shown how holograms are projected precisely onto the abdomen using surface recognition alone. An electromagnetic generator additionally helps to pinpoint lymph nodes in the abdominal cavity. The system even shows the surgeon exactly down to the millimeter how far their instrument is from the actual tumor. So here you can also see it absolutely helps the surgeon to do precise work.
Precise work on children. That something very different on the has its complication, I would say. No? So a huge step forward for endoscopy is the AI system GI Genius, no? Which automatically detects adenomas during coloscopy and marks them in the Vision Pro cockpit. No? This eliminates the constant shifting of focus between the patient and the external monitor on the wall. No? According to the study, this significantly reduces cognitive load and short-term shortens the operation time by available 10 minutes of average. That's some,
like they always say, time is money, right? So the less the operation is, the more you save the money, and it's also a big thing, of course. Yeah. The time savings in neurosurgery, where a tumor was removed directly at the optic nerve, were even more staggering. Thanks to the extremely good 3D planning and the direct overlay during the operation, the surgery time was significantly reduced. The patient recovered from this massive procedure so quickly that they were allowed to go home after just a few days. This is brilliant, right?
This is brilliant. In terms for the patient, it's very important that they have days at the hospital, not so much days at the hospital. No? They have not so many risks. I would say. No? Yeah. We have seen that there are also brilliant tools for the operating room staff, no? Such as the Canopus system, no? Which uses machine vision to recognize over 40,000 instruments. That's too much. That's really too much. No? The AI predicts exactly which scalpel or the clamp the surgeon will ask for the next through the headset from the scrub nurse. No? If an important instrument, we say it's missing from the table, the system immediately sounds the alarm, no? Enormously reducing stress level in the room.
Yeah, that was impressive. So they had this operating desk and there were all the tools. I have no idea about that. And I could put the Vision Pro on and then I see what all the instruments are and then I can give them to the surgeons. So even I could do that perhaps. This is crazy. Yeah. This is crazy. So the final stage presentation revolved around the state-of-the-art robotic-assisted knee replacement. Here, the doctor maps the bone with a probe to obtain a perfect 3D model for planning the exact cuts directly in the headset. A robotic-guided burr then takes over the actual removal of the bone, leading to extremely safe results without additional complications. So also very, very helpful if they use it then later on. Yeah.
The precision is really important, no? In the operating room, no? Yeah. So, to wrap things up, no? We were able to conduct a fantastic interview with a fantastic plastic surgeon from Vancouver. No? She uses the Vision Pro to safely harvest tissue, no, from the abdomen for complex breast reconstruction. So let's take a listen to that right now. What's for us?
Yeah, what she said. So let's check out the interview. So guys, we already found somebody here. We can do an interview. It's Katherine Isac. It's a medical doctor from Vancouver. And she will tell us a little bit of the work and also what the benefit is of the Apple Vision Pro. So can you introduce yourself and also what are you doing and what the benefit of the Apple Vision Pro is at your work?
Thank you very much for this interview. So I'm the plastic surgeon that focuses on breast reconstruction at the University of British Columbia. I'm also the a P. Clugsted Chair of Breast Reconstruction Research. So I'm able to both do my clinical work and research so that I can innovate and help patients in the operating room and then take those problems and solutions and investigate them in my research program. And so it allows me to be very innovative in the work that I do. And so as soon as I saw the Apple Vision, I knew that it would be helpful in making my operation for breast reconstruction much more specific to the patient. And so what I've done is I've taken the Apple Vision Pro as a hardware platform, and we've created a software so that we can take the patient imaging on a CTA and we put it onto the patient in the operating room so that the information from the CTA can be seen onto the patient. When I do a breast reconstruction and I'm transplanting tissue from the patient's abdomen to build the breast, I need all of that detailed information from the CTA to help me plan the surgery and plan the flap so I can make sure that the flap is the right size, the volume that I need to reconstruct the breast after it's been removed, and that the blood flow to the tissue that I've taken is optimal. And so with the Apple Vision Pro, I was able to take all of the patient-specific imaging, put it onto the patient, understand where their blood vessels are so that I can design the flap. And the way we used to do it before the Apple Vision Pro is I would take the information from the CT scan and I would try and make up in my mind a map of where the blood vessels were. And then I would take a ruler and measure on the CT scan and then take a ruler and from the umbilicus on the patient, trying to use the ruler to find out where those blood vessels were. And then I would confirm with a Doppler. So now instead of that, I can just take the direct imaging and have it right on to the patient, and then I can draw the blood vessels exactly where they are. And they're quite complicated. They're sort of like a tree with branches. And so I can draw the exact anatomy of the patient, like a tree trunk with all of these complicated branches, and that makes the surgery faster. And it also makes the surgery safer because then I don't have to disrupt all the important muscles and nerves that are within that tree and the branches. So it makes the surgery better, and we're evaluating this with a randomized clinical trial to demonstrate what is the quantifiable benefit of using the Apple Vision Pro, because I know through my years of experience that it is better, but I need to demonstrate in a measurable way that it's better and how it's better. And so that's what we're doing at the University of British Columbia.
Thank you very much. That's really interesting, especially for me, because on this channel we normally only have like entertainment things.
Oh, interesting.
And that's very interesting. So you can see that Apple Vision Pro is not only in entertainment, it's very interesting also in the medical area, and that's very brilliant. And I will also show you some material that I recorded that she also showed us, and it's gonna be very interesting. So thank you so much for this interview.
Thank you.
And have a lot of fun with that and a lot of success, of course.
Thank you. I really
Thank you.
appreciate it. Thank you.
Yeah, guys, that was really amazing and completely different to that what we normally see here, like entertainment and sim racing games, whatever, movies. That was a really brilliant use case. I didn't even know that exists. I mean, of course, I know that they use it in medical area, but like all these concepts, all these ideas, and all the operations that they already used the Vision Pro in is so impressive. Yeah, it's so impressive. And but the thing is, yeah, we are here in the European Union, and you know we have a lot of regulations, millions of regulations. So you in the United States, you are already using that a lot. They showed us. You don't have this crazy regulations, but we can only use it like for placing some monitors. This is the maximum we are allowed to use. And so this is so bad. So this is so bad and sad that we cannot use that. So we have to get over the regulations. So one of those guys that decides that, they even said like the surgeon could get like eye problems using the Vision Pro. What the heck? I mean, I use VR since 10 years and I don't have problems. So what are they
What
talking about?
What do they mean by eye problems?
Yeah,
I could say better with
So,
a Vision Pro.
Yeah, so I think those people that are deciding that are like 90 years old guys that never seen a new technology. I don't know, whatever. It's crazy. So be happy that you live in the States and you have not so many regulations. However, I hope later in the future we will also be able to use that a lot more.
Yeah, of course, that is the future.
Yeah, it's a future and it helps a lot. And it also shows that we all say on this channel always the Vision Pro is so expensive. So here in Germany, for example, it costs 4,000 euro, and in the States, I think they raised the price right now from 3,500 to 3,700 US dollars. It seems a lot, but imagine you can replace like tens or hundreds of monitors in different operating rooms with just one Apple Vision Pro. Yeah, so you can even save money with that, and also it saves time in the operations, and it helps, like for example, this remote sessions with people like all over the world can help and work together in one operating room. This is brilliant with this Apple personas, these avatars that you can use. Very impressive. So for me, that was a blast to see that used in the medical area. Like absolutely amazing, and I hope you also like that. It was like completely different than my other videos, but perhaps it's gonna be interesting for you. Yeah, and yeah, my wife is a doctor. She has a lot of more knowledge about this. Perhaps. Yeah, what do you think about that? Do you think it's the future? Or?
Yes, definitely is the future. No, we need to do as much as we can this technology in Europe to bring.
Yeah.
We need to have it. No? I was more than impressed while I've seen all in operation room, I've seen all inpatients. So when I can make the difference, how much that can help. How much it can help us as doctors, and how much can the patient benefit.
Yeah, brilliant. So yeah, perhaps there is a wonder happening here in the European Union, and the regulations are going down. I have no idea. However, guys, if you liked the video, give me a thumbs up, subscribe, hit the bell. And if you want to know more about this exhibition, as this will also be in San Diego next year, so closer to you perhaps, you can also take part. I will put the link in the description below. And I also want to thank all the people that were involved to organize that in Germany. This is crazy, here in Germany. And thank you so much also to Apple to have their Vision Pro here and to collaborate with the doctors and so on. This is really nice. So guys, thank you for watching, and see you next time in virtual reality. See ya.
VoodooDE